The idea of all drugs being lawful in a world where drug laws differ greatly is fascinating but unrealistic. Though some nations have taken steps to decriminalize or legalize particular substances, reaching a worldwide agreement on the legality of drugs without restrictions is still a difficult and controversial issue. Accordingly, the subject of our conversation today will be investigating every country where every drug is legal, covering everything from the legalization of cannabis to creative methods for treating heroin addiction and reconsidering the use of psychedelics. This will provide insight into the complex relationships that exist between drug laws, public health, and social attitudes. Cannabis was formerly classified as a forbidden substance, but its legal status has significantly changed globally. In 2013, Uruguay became the first nation to fully legalize cannabis for recreational use, setting the standard. Since then, a number of other countries have done the same, including Canada, Mexico, and a few US states. These policy modifications are a reflection of changing perceptions of the plant, which acknowledge its medicinal properties and remove long-standing stigmas. Portugal began using a revolutionary decriminalization policy in 2001, even though it has not yet fully legalized all narcotics. People found in possession of minor amounts of narcotics for personal use are referred to the Dissuasion Commission, where they may be subject to fines or community service in place of criminal prosecution. With the goal of minimizing harm and promoting rehabilitation, this strategy places a higher priority on handling drug usage as a public health issue as opposed to a criminal one. There has been a renewed interest in psychedelic substances' possible medical advantages in recent years. Psilocybin-containing mushrooms and ayahuasca have long been used in Brazilian and Jamaican cultures and religions. A significant effort is underway to legalize or decriminalize certain drugs in order to make them available for more widespread medical applications. State-level progress has been made in the US, as evidenced by the decriminalization of psilocybin in places like Denver and Oakland, which points to a change in policy regarding psychedelics. A number of European nations, such as Germany and Switzerland, have implemented cutting-edge strategies to combat opiate addiction. In opioid substitution treatment (OST), prescription opioid drugs such as buprenorphine or methadone are used in place of illegal opioids. This harm reduction approach seeks to stabilize users, lower the health hazards related to drug use, and offer a route for recovery. Although they do not legalize all narcotics, these nations give priority to practical measures to address the opioid crisis. Legalizing or decriminalizing drugs raises legitimate concerns in addition to possible benefits. Some who oppose the policies claim that they could worsen public safety, increase drug abuse, and put a burden on healthcare systems. Developing strong regulatory frameworks, funding education, and closely observing the effects on public health are essential for countries implementing these policies. Legalizing drugs will have a variety of effects on the economy. Legalizing and controlling some substances has the potential to bring in a sizable amount of tax money. For instance, in states where cannabis use is legal, the business has grown to be very profitable, which has boosted employment and the economy. The possible rise in substance abuse and related health problems, however, may put a burden on healthcare systems and counteract some of the financial advantages. The legalization of drugs has taken on a wide-ranging global landscape, reflecting the different political, economic, and socio-cultural circumstances of every nation. With different degrees of conservative principles or progressive thinking, nations negotiate this complicated issue. These decisions are frequently influenced by international agreements and conventions. It is still difficult to strike a balance between national autonomy and international cooperation when nations try to come to an agreement on drug policy. As we come to the end of this investigation into the fictitious world in which all drugs are legal, it is clear that drug laws around the world are complex and multidimensional. The idea of legalizing all drugs is still unusual, even though some nations have embraced progressive policies like decriminalization models, cannabis legalization, and creative ways to combat substance abuse. The various strategies used in various countries show how public health, individual liberties, and social norms are still being discussed. It is crucial to find a balance that protects citizens' welfare while taking into account the changing views on drugs as nations continue to negotiate in this difficult environment. The shift from drug prohibition to regulation necessitates continued study, international cooperation, and a dedication to comprehending the complex effects of drug laws. In the end, the international community has to promote an encompassing and compassionate strategy that acknowledges the significance of evidence-based practices and places the welfare and health of individuals first within the larger framework of societal norms and values. Well, that is it from us today. Let us know your thoughts in the comment section below. Take care until next time.